My name is Robert Puccioni. I'm a student at Pikes Peak Community College in the Medical Records Terminology class, and today's topic is atopic dermatitis. The diagnosis and presentation of atopic dermatitis is commonly known as eczema. It's a chronic inflammation of the skin, and it's assumed that it occurs in patients with family history of allergic conditions. Now moving on to the etiology of the disease. Etiology is the word meaning the cause. That's why we have the little wise old owl here. Idiopathic means a condition which arises spontaneously or for which the cause is unknown. Now for this, we do assume that an allergic connection is already there. Now for infants, this may be traceable back to a sensitivity to milk or orange juice or some other food that you may have been ingested or they're currently being fed. Continuing on our exploration of the causes of flare-ups, stress is a big factor. Anxiety, conflicts, all these can cause eruptions. Sudden temperature or extreme changes in temperature could cause dryness or cracking of the skin. Atopic dermatitis, um, things that come directly in contact with the skin. Wool, that's another big factor. Fortunately, these things do tend to improve with time once the um, offending situation goes away. Usually the symptoms start to calm down. Going on to signs and symptoms. On children, we have an example here. Rash with vesicular meaning a cyst-like or a sac-like, and exudative meaning oozing. So here we have um, eruption with little pustules oozing from this child's face. It's kind of hard to see in this picture. Going on to the adult picture here, we have dry, leathery vesicles. Here it's a little easier to see. Um, the patches of dry skin on the hands, legs, back, and the back of his legs. On this slide, we could see in more greater detail what these rashes typically look like. Here around the face is a really good example of all the dry, leathery skin here. Next one's going to be around the neck. This one looks like he's coming off from a flare-up. Next one, you can see the dryness around there. It's silvery. This looks like it might be closer to a form of psoriasis, which is also a form of eczema. Next, we go to the knees. This is on the back of the knees, and um, these also itch a lot, also, which we'll talk about here just coming up, and in the upper trunk area. And this is also on the back as well, accompanied by pruritus. Um, Pruritus is urgent need to scratch. That's why I have the little cat there. I'm allergic to cats myself, so that's why I put the cat up there. It's an urgent need to scratch. And that's probably going to be doing the most harm um, besides the physical things that you see up on these slides right now. Moving on to testing and diagnostics. Of course, you want to start off taking a good medical history for the patient. And as we said earlier, we're always going to assume there's a family connection to this. So make sure you get a good family history. Somewhere somebody's going to be allergic to something. Next is going to be the visual examination of the skin. And finally, there's going to be tests for individual allergens, skin testing. And you got to remember, this is going to be more than just a physical uh, ailment to the patient. You've seen a lot of those pictures. This has a psychological effect on the patient as well, especially when a lot of those blemishes appear out in the open, especially on the face. So it's more than, as they say, skin deep. So at this point, what exactly can we do for the patient? Well, the best we can do right now is try to relieve the symptoms and the severity of the eruptions. We're going to try to relieve the pruritus or the uncontrollable urge to itch. We're going to try to do that with local or systematic medications. What that means is either something that's going to work either local, like a topical um, cream or analgesic, or systematic means something that he's going to ingest that's going to work throughout the local system. Um, some of these would be like antihistamines, um, which will help reduce swelling or inflammation, tranquilizers. Remember, we said that stress is going to cause flare-ups, even sedatives, depending on how severe the symptoms are. So where does that leave us with the patient? Well, unfortunately, there's no cure, there's only control. And in simple cases, there are skin moisturizers. Thankfully, there is always that big ball in the sky, the sun. There's sunlight therapy. And with that, um, the UVA light that gives off, which is beneficial. Remember, too much is not good for you, but UVA in the right amounts is good. And of course, to use that UVA light, we do need to have vitamin D. Um, and if you're not getting enough vitamin D, then there are, um, you can get that over the counter. For increasing severity, there are topical ointments available with creams and cortisone. Of course, cortisone is a steroid, and if you and your doctor are worried about that, there are new NSAIDs available designed specifically for eczema. So you could try some of those now, specifically made without steroids in them. And we're almost to the end. Continuing with the treatment, remember we started talking about why scratching is so bad. It's because secondary bacterial or infection is possible from scratching. It's the most common complication. There are antibiotics prescribed to control infection, but sometimes the risk of certain viral infections is as serious or can be more deadly than the original disease. Not to say that atopic dermatitis is deadly, but that can lead to other things. A small cut in the skin, once it skin opens up, which the skin can crack and open from this. Um, Anything can get in there. Could lead to gangrene or any other sort of thing. So risk of viral infections is a serious threat. And now we come to the close of the presentation. The prognosis is reducing the frequency and severity of eruptions and relieving the constant itch are positive outcomes. There is no cure for eczema. Medications can only control the inflammation and the cycle begins again. Many occurrences resolve on their own, but may recur later. So past is the past. Don't let it hold you back. Move forward and don't look back. Thank you very much. These are the sub-competencies I hope I demonstrated today. Um, Place of interest of patients and populations at center of interprofessional healthcare delivery and population health programs and policies with the goal of promoting health and health equity across lifespan. Choose effective communication tools and techniques, including information systems and communication technologies, to facilitate discussions and interactions that enhance team function. And finally, integrate the knowledge and experience of health and other professions to inform health and care decisions while respecting patient and community values and priorities preferences for care. And finally, here's my reference sheet. Thanks very much. My name is Robert Buccioni again, and thank you for listening. Have a good day.